For 31 days, October brings the impacts of breast cancer to the forefront of the national conversation. But the real conversation lasts much longer with patients, survivors, and their loved ones.
Today, we're having a deeper conversation into diagnosis and the work from others in the community to help bring a healing hand. Welcome to Real Talk with Denver7 and CPR News. I'm Colorado Public Radio's Nathan Heffel.
And I'm Denver7's Micah Smith. Each week in a partnership between Denver7 and CPR, we'll be having a real talk about issues impacting underrepresented people across Colorado.
And we're going to start with a large number. 242,000. That's about how many people are diagnosed with breast cancer every year, according to the CDC.
Breast cancer is the second most common cancer in the United States, killing nearly 910,000 women from 1999 to 2020. But women aren't the only ones affected. The American Cancer Society predicts about 2,800 men will also be diagnosed with breast cancer this year, and about 350 men will die. Starting our real talk, we want to hear from the professionals when it comes to these diagnoses and how to stay aware of your health.
So joining us now are Doctors Nancy Taft and Gray Joden from Denver Health. Thank you both so much for being here today.
Thanks for having us.
Thanks for having us.
I think the obvious question is to ask, who's the most at risk for breast cancer?
Risk and assessing the risk, that's one of the biggest things that we do. We feel pretty passionate about it because we can empower people to make some decisions about their care. There's two features that of the people who have high risk. One is that they're born biologically a woman, and number two, aging. And unfortunately, a lot of people think as they get older that they're past that point, but in fact, that's not true. I would say the one thing I've found since I've been here in Denver is that I'm seeing a lot of young patients. And when I first got here, I was like, what's going on? But I looked at the statistics for the state, and the county of Denver actually has a large number of people less than 50 years of age. I saw 6 patients with cancer in a clinic last week, and 3 of them were less than 50 years old.
As a social equity reporter, I often look at disparities when it comes to patients, when it comes to care. So I have to ask this next question. Why do Black and brown women die from breast cancer more often, despite there being such a large gap in cases between us and, say, white women?
So that's something that we've studied a lot, and there's a lot of concern about that. What we've inherited here in the United States, a very diverse population, different ethnicities and races. It does provide a little bit of a challenge for the oncology community and how to manage that. We know with ladies that are Black and brown that oftentimes they have what's called triple negative breast cancer. And that means a lot of the targets that Dr. Joden here recommends, that they're not candidates for that. So these people, a lot of times, they have to have chemotherapy. A lot of times they have a genetic mutation. And then the last thing that we want to look at is we want to make sure, and this one thing I love about Denver Health is making sure that they have equal access to care.
Dr. Joden, go into that a little bit more. In terms of the, what you're looking for when you're assessing someone who possibly has breast cancer, and the fact that they might not know the signs themselves. Does that make sense?
Yeah, absolutely. And so the usual signs and symptoms for breast cancer, it's typically a small bump, sometimes bigger, that you feel in the breast or under the arm. And sometimes you can think, it's a bite, maybe I got a bruise, but oftentimes it's something that needs to be further evaluated, and sometimes it's ignored. And so we generally do recommend that if you feel a lump in the breast or under the arm, that you go see your doctor just to make sure it's not something concerning like cancer. Kind of regarding the markers that Dr. Taft was referring to, the breast cancer is a large spectrum of different types of cancer, and some are hormone positive, meaning that estrogen or progesterone, hormones that women have high levels of, are driving the growth of the cancer. There's also a protein called HER2 that can drive cancer growth. And so when we're looking at new cancer diagnoses, we're trying to see if the cancers have these markers. And if they do have the hormone positivity, we can use anti-hormone treatments to treat the cancer. If they have a HER2 positivity, we can use HER2 targeted treatments. But in triple negative patients, which means they don't have hormone receptors or don't have HER2 receptors, that means none of those treatments will work, and we're kind of limited to just using chemotherapy and sometimes immunotherapy for those patients.
Dr. Joden, I do want to talk about men and breast cancer because men can get breast cancer. Are they as likely as women to get it? I guess who is most at risk?
Yeah, so Men are a lot less likely to develop breast cancer than women. Out of all breast cancer diagnoses in the United States, about 0.5 to 1% are men. And to give that a number, it's less than 3,000 patients per year. And so in general, it's a lot less common for men to get them. But the symptoms that men have who do develop breast cancer are the same. It's usually a lump in the chest that they can feel or under the arms. But men in general don't think about breast cancer because they're men and generally don't think that they're at risk for breast cancer. And so they oftentimes won't think that something growing in their chest could be cancer.
Now, Dr. Taft, I think there's a sense of we have people of color, and you add on top of that, person of color who is a male. And is there a correlation there that men who maybe are of color are more at risk than not?
They may be at risk. Like, we do genetic testing, and if they've inherited a gene, in fact, every man that's diagnosed with breast cancer, we send them for genetic testing. And I think we so many times focus on the women in the group, but I think when there is a family history, the men need to be tested right along with the women. So then they definitely fit in that category.
But you add that stigma into that as well,
Right.
of being a man with breast cancer. That's got to be tough to overcome as a doctor, saying, it's okay, we see this is not just you.
And they come in, and you'll think about it. I mean, they're coming into women's imaging. You know, a lot of times it's pink. It's all, you know, kind of decked out for women. I find some of them are a little embarrassed about it, and so it's a difficult conversation.
Yeah.
Absolutely. When you do get a breast cancer diagnosis, I like to be hopeful. Can you walk me through some of the things that are already in place when you go to the hospital? What can you expect? Because I do know that medicine has come a long way, lots of treatment options. Can you walk us through that?
The first thing is that before you've arrived, we've already gone through your records in detail. We've spent a lot of time looking at your imaging, looking at your pathology, you know, going through all the old records, trying to find out what's your family history. So we've done a lot of preparation for you, and we a lot of times have outlined a plan before you get there. But once you get there, we have to get to know you. You know, what's important to you? What do you want out of this? What's your life like? Because at the end of the day, we want to get you cured of your cancer. We also want you to get your life back.
Absolutely. Well, Dr. Joad and Dr. Taft, thank you so much for joining us for this Real Talk. And we still have a lot to cover. We're just getting started with this Real Talk about the impacts of breast cancer and being aware of your health.
Yeah, and when it comes to care and treatments for patients, it's not always the same for every person, as you just heard, even when it comes to availability and affordability. Coming up, we take a look at the disparities in care for Black and Hispanic communities across Colorado. Welcome back to Real Talk with Denver7 and CPR News. I'm Colorado Public Radio's Nathan Heffel.
And I'm Denver7's Micah Smith. It is Breast Cancer Awareness Month, and today we're talking with experts about what to look out for and who it affects. Over 173,000 white women and 28,000 Black women are diagnosed every year. Now, despite the drastic difference in number of cases, Black women have the highest breast cancer death rates of every ethnic group.
Yeah, Black women had a 41% higher death rate from breast cancer than white women from 2011 to 2016. And joining us now to talk about these numbers is Jackie Wesley with the Colorado Cancer Coalition. Thanks so much for being here.
Oh, thank you for having me.
So tell us a little bit about your role with the Colorado Cancer Coalition. What have you noticed when it comes to cancer care regarding women of color?
So my role at Colorado Cancer Coalition is I just became the chair of the Breast Cancer Task Force. And the goal is to get out in the BIPOC community so that we can raise awareness with women of color because, you know, Black, Indigenous people of color, we have a higher death rate. And so the goal is to get out to the community and make sure that those folks get checked, make sure that they know the facts, make sure they know how to check. And so that's the goal of the task force.
And Jackie, this is personal for you. You have lived experience. Would you mind sharing some of your journey with us?
Sure. So I was diagnosed with stage 3B ductal carcinoma back in 2003. And I had a bilateral mastectomy, reconstruction, chemotherapy, radiation, and a 5-year regimen. So my goal was, when I was diagnosed, there was really nobody that I knew to talk to about it. And so my goal was, let me help other people fight the battle. And so that's the purpose of fighting together to save lives, so that people don't have to be alone. Because when you're diagnosed, you're very afraid. It's like a death sentence. But if nowadays it doesn't have to be a death sentence, because we have awareness out there, we have better odds. So the goal is to make sure that you're educated about breast cancer and how it affects your personal life.
Yeah, and I know it's not always incumbent on us to advocate for ourselves as people of color, but is there a way for us to be a cheerleader when we go in there after we get that diagnosis, saying, I think I know, I need to know what's going on, and can I advocate for myself? Because I am a person of color, and there are disparities there.
Well, I tell you, you are your own self's best advocate. And so it's important for you to be aware of your diagnoses. It's important for you to ask questions. It's important for you to get the answers to those questions, and don't leave until you can get them. Because if you know what your diagnosis is, then that battle is your journey, and it gives you the ability to fight harder.
Yeah.
Jackie, my grandmother was a breast cancer survivor, but I didn't know this for the majority of my life. And I noticed at least a trend in my own family that a lot of the black women who were survivors really didn't talk about it when they were going through it or even after. Why do you think that is in our community?
For me, in my community, I believe that it's because of fear. You know, people are afraid of how they will look different. And so, this year for October, the story behind the mask, we all have a story to tell. But the deal is when we get diagnosed, we believe that we look different. So we want to mask up and don't let anybody know, and so we just want to keep that same face that they're used to seeing. But really, behind that mask, they are, it's a tough battle.
But again, every October, every Breast Cancer Awareness Month, the pink ribbons come out, the cancer runs come out. It is so widely known that this is such an important topic. Why is there that fear? And is it just for the people of color community, or is it really everyone?
I think it's everyone. Nobody wants to know that they're sick, and so half the battle is knowing. Right? But if you don't go get tested because you think you're not at that age bracket, oh, well, I'm not 40 yet, I don't need a mammogram. But if you have family history, then you need to consider that, because, genetic testing is real and you can find out that way. But if you know that you have a grandmother or aunt or a sister, you want to make sure that you're doing your monthly breast self-exams. Yeah.
We do know the runs and the ribbons do raise money for important research and other things. When you go and meet with patients, when you go and meet with women, men who are going through this, what are some of the immediate needs that they need most?
Well, I can tell you for us, it's basic needs, and the basic need is a mammogram. And so some people that don't have insurance, they have, not good health care. The goal is to partner with the community to make sure that we can get those resources out to those folks that don't have insurance. And there's many avenues out there, but again, if no one knows, they don't know what to ask. So we want to continue to raise awareness. We're going to want to continue to let folks know that there are resources available in the community at the different healthcare level that are willing to help these women and men get mammograms.
And when you were going through this, is there anything that wasn't told to you or told to you maybe later on in the process that you wish you would have known up front?
Well, my eldest sister is a 3-time breast cancer survivor, and so I'm the 5th girl. And so I went in with knowledge because I watched her. But for me, my thing was to making sure I had all of the information that I needed. So I researched. I tried to find out what would happen for being an African-American woman. And so that's how I just really kind of got involved, because if we don't look to know, we don't know.
Yeah. And I think that's such an important thing. If we don't look, if we don't think about it, it's still going to be there.
Right.
That's right.
Hiding from it isn't the way to go about this.
No, it's not. It's cure is available, and when I say cure, I mean if you get tested early, and if you go in and take care of, getting the mammogram, and if you have a lump, to getting the biopsy. Knowledge, truth to power. That's what's important. So if we do that, then it's the numbers will come down. But the goal is to have the courage to take that big step.
Take that big step.
And that is a big step.
Yes.
We don't want to diminish it, because we know this is very scary. But as I said before, I like to end on hope, and I like that testing early, there is help out there. There is a community of people there and willing to help.
Yeah.
All right, Jackie. Well, thank you so
thank
much
you for having
joining
me.
us.
I appreciate you.
And we're continuing this real talk about the impacts of breast cancer.
Coming up, we take a closer look at how some in the community are using their talents to help those who have had mastectomy turn their scars into art or even inspiration. This is Real Talk with Denver7 and CPR News.
Welcome back to Real Talk with Denver7 and CPR News. I'm Denver7's Micah Smith.
And I'm Colorado Public Radio's Nathan Heffel. After a breast cancer diagnosis, some doctors recommend a mastectomy. It's a surgery that removes all breast tissue to prevent the cancer from growing any further.
And for some, that surgery brings years of pain and a feeling of less than. But there are artists that are turning those marks into art or even inspiration. So joining us now is Aaron Official of Iconic Ink and Victoria Tovar of Lavender Aesthetics to talk about their work here in the community. Thank you both so much for joining us.
Thank you for having us.
All right, so both of you do this special kind of art. Talk to me about what led you into this, and we can start with you, Victoria.
So I've been a licensed cosmetologist already for 9 years, and I briefly worked at a tattoo shop. And I wanted to bring something to the table as well as a tattoo artist, not necessarily like art-wise where it's like portraits or anything, but since I already was in the beauty industry, I just thought of tattoos and beauty, and they collide and they bring this type of art.
And what do you specialize in specifically with mastectomy tattoos?
Just recreating the nipple and areola 3D, so it's more photorealism.
Yeah, very important. Aaron, what about you?
So I didn't really decide to get into this. I got a phone call one day and pretty much decided to take it on, and over the years I've done quite a few of them.
Yeah.
And tattoos in themselves are so personal, you know. But I'm thinking when someone has a diagnosis or has the surgery, it's so deep, right? It's such a deep feeling. And when you're doing the work, are you working with people to maybe hide it, but then maybe also show the fact that they've had a mastectomy as well?
I would say definitely to hide it. Most people really, it's just getting their confidence back, you know, putting something beautiful over what's there. It isn't necessarily going to make it go away, but it's something else to look at, you know?
And Victoria, for you, it's reconstruction in a sense,
Yeah.
right? Yeah.
So I'm in that sense, I'm just recreating what's either there already, or I'm recreating both areola and nipples as well. Instead of hiding it, I'm more disguising it in a way.
Thinking about the process, and Aaron, this one's for you. I know tattoos in general, sometimes it takes 1, 2, 3 sessions. Are these multiple sessions? Does it just depend on the request? What does the actual session look like?
It definitely depends on what's getting done, because the detail of it can make it take longer, but it's generally something that could be done in a full day. But some people want to go higher up onto their chest, and that takes more time, you know. It's very, very variable to the situation, you know. Yeah. There's a lot of factors involved in how long a tattoo is really going to take.
And what does it look like for those listening on the radio? Or I mean, is it really? I guess just explain what they look like.
So what I do is like delicate, fine line floral work. So it would be something like that, you know. And it can be like almost like the Little Mermaid type of shells, or it can be almost like a bra kind of shape. It kind of depends on, you know, really what people want. And what we're going to do.
And it's like a consultation that you guys really must become so close while you're learning exactly about what they wanted, because that, you know, it's so important to them. Yeah.
I know as artists there are certain works of art that you've created that stick out in your mind. Would either one of you or both of you mind sharing some of the clients that you've had and the work that you've done with them that really stick out to you?
For me, I think some clients do tend to get a little bit more fun with this. So instead of just recreating a regular just oval, just areola and nipples, some of the patients do ask for more of like a heart shaped and get a little bit more creative just to bring some fun out of a situation that didn't bring so much fun in the past.
Yeah, and Aaron, you mentioned shells or maybe a bra or any of your art pieces sticking out in your head with this question.
It's not so much the actual piece of art that sticks out in my head, it's really just the feeling that I can tell after I'm done that these people just feel better about themselves, you know? It's not so much about the actual creation of it, but the final effect.
Yeah.
Because I mean, a tattoo artist isn't a world-changing job. It's not. It's not something that's really super impactful on a daily basis. So when I get a chance to do something like that, it kind of makes me feel better, you know, than the average day.
Yeah. And you said you didn't get into this kind of to do this type of work, but are people now searching out saying, hey, I really feel that you're doing a great job. I'd like to have you work with me.
That's kind of how it goes, word of mouth. One person leads to the next. I wouldn't say it's like an every week thing, you know, but, and thank God, because that would mean more people are having that issue with cancer, and the less I do it, the better off the world is, you know?
Yeah.
What about you, Victoria? Do you partner with any organizations, or is it kind of same word of mouth? People just learn that you do this?
A lot of word of mouth. I have ran into like working with some organizations of breast cancer, or I've had just referrals from people that have been in a breast cancer just like clinic or anything like that, and they're like, we suggest you look at a cosmetic side of it, just because obviously surgery doesn't always work well. And honestly, it's not a thing that's been searched a lot. I don't think a lot of people think of like wake up in the morning, they're like, I'm gonna get my areola nipple tattooed today.
Right. But I think the fact that it's something that you do, that people are searching out to do that, it's fascinating to me that is something that is artwork, right? Does that make sense? That people are saying, this is what I want to have done because I'm having this traumatic experience, and it makes you feel more comfortable, feel more alive, feel more yourself, if that makes sense.
Of course, yeah, definitely. Especially like when a client has just one areola and nipple just left, then it's that constant reminder when they're by themselves in front of the mirror. It just doesn't make them feel as confident as they used to be. So it's almost kind of like when you lose all your hair, the areola and the nipple, it's just a constant reminder of the negative things that came with it. So I just love that I'm bringing a positive outlet for them and just bringing back that confidence and that smile that they once had and they haven't seen in a while.
Yeah.
All right, I'm going to get real here.
Okay,
I'm
here
going
we
to state
go.
the obvious. This is not an arm tattoo. And with that said, with it being in a more sensitive area, is there a different approach that you take or anything like that?
Well, so I found a lot of times these women have lost a lot of sensitivity in that area, and the ones that I've done have actually been mostly replaced, you know, with a fake breast. So it's kind of not an issue, and I think maybe they've gone through so much pain with the whole process already that it just really isn't a big deal to them, you know, as far as pain-wise.
Right, that makes sense, especially if they're going for more of an artistic piece that's representative of their journey instead of the nipple reconstruction.
Right.
All right, this has been a really interesting
has.
talk. I want to thank both of you for being here with us today for this Real Talk, and thank you for the hope that you're bringing so many survivors.
Actually, thank you guys, really.
Thank you for letting people know that we're here to help them.
Absolutely. Well, that's this week's episode of Real Talk with Denver7 and CPR News. Every week, we'll be having a real talk on issues that impact Coloradans who are often overlooked.
And you can find all of our shows on denver7.com/realtalk or at cpr.org/realtalk. Have a great day.